And you may have heard the meeting recording just started. So I will now hand it over to our Deputy Assistant Secretary for Aging, Edwin Walker, for welcome.
Good afternoon, everyone. Hello, and welcome indeed. I am pleased. Elizabeth said she was happy. Actually, I think I'm thrilled. After nearly 30 years of advocacy at the federal level and having previously served for 4 years as an APS director, this is just thrilling to finally see for the first time direct funding allocated for the Adult Protective Service agencies and the work that each of you does. So I just wanted to open by thanking the many advocates, specifically NAPSA and the Elder Justice Coalition, for their incredible work in securing this funding. So I would encourage each of you to do the same thing. We think that this funding that was secured for APS related to COVID and the response in that regard is great, and we're hopeful that it really is the beginning of something new, a new foundation or for baseline funding or core funding on an ongoing basis for APS. We've been talking about this for decades, and now we see the beginning of it. And, you know, now that we have the beginning, it's okay to be greedy, I guess I would say. Today, we will walk through the process for applying, as Elizabeth indicated, and for accessing these funds. I want to give a shout out and thanks to an incredible ACL team who have really put all of this together. We've charted out new ground, actually, because never before has ACL provided grants directly to APS agencies. And what we've tried to do is to keep it as easy and simple as possible. We are all in this COVID environment where we're working remotely, and we need to try to make this as easy as possible for you to access these funds as quickly as possible so that you can use those funds to respond to the needs that we've heard about as we've engaged with you. So with that, again, I just wanted to kick it off and thank each of you for your participation and for the great work that we know you're going to be doing. Elizabeth?
Thank you so much, Edwin. So next on our agenda, we will hear from Hillary Dallin, the Director of the Office of Elder Justice and Adult Protective Services. Hillary?
Hello, everybody, and just like everybody else, we are so incredibly, I'm going to just keep up with the adjectives and the adverbs, overjoyed and ecstatic to be at this point after so much time of everybody working so hard and aspiring to this moment, and here we are. So before we proceed into the kind of, if you will, the meat of the matter, I think we should just take a moment to exhale and celebrate that we have gotten here. So exhale, inhale, now let's go. So there's a lot of work ahead of us, obviously, all of us together, and I do want to emphasize, and you will hear this many, many times over the next 50 or so minutes, we are all in this together. We are going to be supporting you in all kinds of ways that you will hear about. And we are collectively going to work together and really make sure that this money is used in the ways that all of you have been talking about needing, certainly since last March, if not before. But, you know, these funds are about COVID, and the needs are just so dramatic, and there's a lot that you will be doing, and we are just incredibly pleased to support you. So, as Edwin said, the rest of this webinar is going to be about walking you through the Federal Register notice, how to apply, what you need to do, some things to be thinking about, and how are we going to support you. So it's going to be about the process, also about the content and the programmatic work that we are about to embark upon. And I don't want to take any more time away from that because it's just too important. So I'm going to turn it back to Elizabeth, and just to remind you all, well, actually first to thank you for all of the questions you've asked us. They have helped us to prepare. for this afternoon. And for the assistance will be technical assistance and consultations will be providing over the next period of time. But want to make sure that there's enough time for you to hear from our experts about what's going to be happening, and then some time for you all to ask questions this afternoon as well. So thank you again, and Elizabeth, back to you.
Thanks so much, Hillary. So as you can tell, everyone at ACL has been working so hard and is so excited to get this money out to you. I am now going to pass it to our team lead at the Office of Elder Justice and Adult Protective Services, Stephanie Whittier-Eliason, who I'm sure many of you know, who will talk about, as Hillary said, the meat of this and how we get that money out to you. Stephanie?
Yes, I am unmuted. Can you hear me okay?
We sure can.
Good. And I'd just like everyone to know that if you happen to be getting emails from colleagues saying that they're trying to join, I am still managing the registration while I'm trying to present. So just have them be patient. I just approved 2 more 2 seconds ago. So we have actually 167 people now registered for the event. That does not include our ACL folks. So a lot of demand here for this information, and let's just jump into it. So we're going to be talking today about grants to enhance APS to respond to COVID-19 that we received through the Coronavirus Response and Relief Supplemental Appropriations Act of 2021. Here's the Federal Register link. We can make these slides available as well afterwards for those of you who like to know the details. It's down at the bottom. You don't need it as long as you have the link. Okay, so quick overview. These grants are for specifically the agency or unit of state government having the legal responsibility for providing adult protective services. We have received some questions related to who can apply. We can get into those in the Q&A session later. Out of the $100 million that ACL received, we are making available to state and territory APS programs $93,880,000. I was just excited about that number, so I made it like bigger. I was going to have balloons and confetti, but I figured that was a little excessive. But we are really excited to get this money out to you all. And as Edwin said, we are trying to make this as quick and easy as possible so that we are not caught up in bureaucratic red tape when really what we want to have happen is you all get the funds and spend it as you need it as quickly as possible. So in the application process, there is a letter of assurance and an initial spend plan, and we'll go over that in a little bit. So again, the purpose of these funds: enhance, improve, and expand the ability of adult protective services to investigate allegations of abuse, neglect, and exploitation in the context of COVID-19. So whatever you're going to do, it does need to be justified in terms of responding to the COVID-19 pandemic. So in the Federal Register notice and in the FAQs, we provided some examples of how states could use this funding. These examples come from conversations that we've had with states, inputs that we've received, questions that we've gotten. So, but again, they're examples. And if you have issues, challenges that you all want to address for your APS programs using this funding related to COVID-19 and they are outside of these examples, that's totally fine. We're just trying to help you all think through what are some of the ways that you can use this funding. So how are you going to get the funds? So there's 3 essential steps. First, we need a letter of assurance from the agency that is applying for the funds, the state or territory APS program. We've received a few questions about that. We can get into it again during the Q&A. The Federal Register notice includes the 4 provisions that are required to be in the letter of assurance. It is simply a letter on agency letterhead that says, we assure that we will do these 4 things, and it is signed by the entity who is authorized, or the individual who is authorized to request the funds on behalf of the state or territory APS program. In addition to that, we're asking for an initial spend plan. This is, as it says in the Federal Register notice, it is a preliminary framework of how you envision spending the funds. What are you thinking about? What are the needs that you know that you need to address? It is an initial spend plan. This plan is being asked for because, 1, it will help us plan our technical assistance to you, but also it begins the thinking process of what are you going to be doing, and allows you to get some of the wheels going within your own program and state of what you need to do, how you want to do it, and with whom you're going to be doing it. So it is not as if, do not look at this as you would, for instance, applying for a discretionary grant, where you send in a work plan and an application. If you want to make changes to that, you have to ask for revisions and get permission from a project officer. This plan is not considered a final product like in the discretionary grant. So please don't stress about it in terms of, if you say you're going to do these 4 things, you're going to have no flexibility to be responsive to changing needs. That is not the case. Do be thoughtful, but don't worry about being committed to something if you have circumstances change in your state. And then finally, the submission process. We are requesting that you all email the letter of assurance and the initial spend plan to the ACL regional administrator for your state. Those individuals are listed in the Federal Register notice. I've also included it here in the slides, but I'm pushing the wrong button. Some of you may know these individuals. If you don't, you now have an opportunity to meet them. We will facilitate those communications if needed and requested. And the applications are due to them March 3rd, 11:59 p.m. Eastern Standard Time. Your email, please, when you email these, do not wait until 11:55 to try and email it. The time and date stamp must be within the deadline or before the deadline for established in the Federal Register notice. So we encourage you, as always, with discretionary grants or other opportunities, to send your information in as early as possible. The beauty of this is that these are real people who you can reach out to if you are having issues, if you have any questions about submitting the information. And again, this not only is their name included in the Federal Register notice, but also their work phone number and their work email, so you can communicate with them. So what is going to be required of you in terms of reporting? So how are we going to measure what was done? You have 2, as always, requirements for reporting with our grants. You have fiscal requirements and you have programmatic requirements. But this funding is formula grant funding, and it is different than our discretionary grants. So for our fiscal reporting, we want you to be reporting how much you spend. That's on the SF 425, and that is due semi-annually. Programmatically, we want to know, what did you spend it on? Those are due annually. Unlike our discretionary grant programs, which require a semi-annual narrative or program report, these grants are going to require an annual report, and it will be a narrative. And we'll provide more information when the awards are made in terms of what details should be included in your programmatic report. But at a high level, we are going to, in addition to how much money you received, We are going to need to know the number or percent of adults that were over the age of 60 that were served. And of course, that is makes sense for those APS agencies that serve adults 18 and up. For those of you who only serve older adults, it's a little easier. We'd like you to record inputs and outputs. So how many trainings did you do? Or how many flyers did you produce? Your outputs, your inputs, and then your impact, the outcomes. Again, we'll provide more guidance and specificity around that when the notice of awards are made. So we are thinking both in the short term and the long term about how we can help support all of these APS programs, as you're getting a lot more money than many of you have had for your programs in the past. So for the first 30 days, right now in February, as you're getting together your plans and trying to think of how you're going to spend the funds, we have available to you readily the staff within our Office of Elder Justice and Adult Protective Services, as well as the staff with the APS TARC. I encourage you first to contact our office. My contact information is everywhere, so if you do not already have a project officer within our office, and even if you do, you can contact me. I can be considered the point of contact on programmatic issues. However, if Elizabeth is your project officer, or Aisha, or any of the others, and you would like to talk to them, you certainly and absolutely can do that. The APS TARC is available. We might refer people to the TARC for very specific questions, the hows, so the mechanics of stuff. But please start with us within our Office of Elder Justice and APS, and we can absolutely make sure you get information you need to support you in this application process. We can communicate with you, our plans to communicate with you, email, if you email us directly. We will update our frequently asked questions regularly. And we also are keeping open the option to have additional calls and webinars that are more interactive if we see or hear that there is a need or a desire to have those for you all. We want to be as supportive as we can as you all are trying to figure out what to do with these funds. Now, in implementation, when you receive the funds, we are developing a technical assistance plan. At a minimum, it's going to include, again, our Office of Elder Justice and APS staff. We also are bringing on, on a temporary basis, additional subject matter experts and a technology specialist. So for those of you who are looking to use these funds to support remote work in terms of acquiring technology or data systems, we will have someone within ACL available to consult with you all about secure systems, secure technology, other considerations. And as we move forward in implementation, we are looking to have everyone assigned a specific person within our office who you can go to with questions, similarly to how we handle our discretionary grants program. We will have email or discussion lists or both available. We will continue to put out briefs and frequently asked questions through our Technical Assistance Resource Center, and again, host calls, webinars, any other means of communication that is at our fingertips to support you all as you go about, once you get the funding, trying to implement it. And we know one of the biggest issues that states have had with our discretionary grants is in their procurement process and their contracting, and it always takes a lot longer than anyone really envisions. And we have a lot of insight that we can share with you all on planning for that and navigating through it. So again, programmatic questions can be directed to me or to anyone else in our Office of Elder Justice and APS. And then if you have questions about submitting, please contact the ACL regional administrator that serves your state. And our current frequently asked questions document is located here on acl.gov's website. The easiest way to get to it is to go to our COVID-19 page, which there's an icon at the top of the web, not an icon, but a little window or box at the top of the web page. You click on that, and actually the APS, as of today, the APS information is listed first, and then underneath that actually is the information for our long-term care ombudsman programs, which are also receiving a allotment from this $100 million. So that was a very high-level overview of the funding opportunity, technical assistance, and reporting requirements. We know we have a lot of questions out there, so I'm going to turn it back over to Elizabeth, who's going to help us navigate through those in the next 30 minutes.
Thanks, Stephanie. So I am going to be the voice of the Q&A. So for those of you who are submitting your questions through the Q&A, I will be reading them aloud, and then our other panelists will be helping to answer them. And I want to start with one that is addressed in the written FAQ document that was released and that I started to answer, and then I realized the copying and pasting didn't really work. So Kim from California says, my program covers both seniors and vulnerable adults under 60. Can services under these funds only cover APS clients over 60? And so I just wanted to refer you, Kim, to the FAQ document, which says, my APS serves older adults and younger adults with disabilities. How can we use the funding? And funds can be used to support the activities that are outlined under the purpose and use of funding. And when you are reporting, you're going to report on the number and proportion of elders served by your agency with these funds. So to be explicit, you can use them for any clients that come into APS. You just need to tell us when you are reporting how many of those clients were over 60.
Elizabeth, this is Stephanie, and actually that is absolutely correct, and I have something to add to it. Yesterday we received another inquiry which was a little more granular than that one question, and it was about providing in summary, specific goods or services for an individual APS client. If you're going to be tracking individual clients in terms of a purchase of something, that should be reserved for someone who is 60 or older. However, if you are enhancing your APS infrastructure, your community resources, training, anything like that, and your program serves adults who are under the age of 60, that's just like Elizabeth said, it's absolutely not an issue. You would just be, like Elizabeth said, reporting on the percentage of clients that were 60 or over. I know it's a little granular, but we just wanted to make sure that we clarified that.
All right, so hope that answers your question, Kim, and if it did not, you are welcome to come back in and ask it in a different way. So Lisa says, I have 12 positions that were, I'm going to assume this means defunded by the legislature, but I continue to have the positions unfilled. Can I use the funds to fill some of these essential positions?
Alice, is that something that you would like to answer for us?
Sure, and I think we had some conversations on this yesterday, and it sounds like from the question that the positions were provided by the legislature, however, they're unfunded. These funds could be used to fund those positions. A word of caution, if your state is providing direct services to those under 60, like we just discussed, funding those positions could be a little, you would want to be able to account for the staff time that was being provided for those clients under the age of 60. So that's my only kind of word of caution with those 12 positions that you're talking about there.
All right, thank you, Alice. We've got another funding question from Rebecca. If funding runs out before the grant period ends, are programmatic reports still required through the grant end date? So if all of the funding is expended, let's say in the first 12 months, would they still have to do the second programmatic report, I'm assuming is the question.
So this is Alice. As far as the financial reports, I can advise you that you can submit a final report at any time if you expend the funds in full. Now, how the program wants to deal with those, if they're on the programmatic reporting, that would be a question for the program office. Thank you.
I honestly have never had a grantee expend all of their funds before the end of the grant period. So we would need to look into that.
So Rebecca, it sounds like that's a good question for follow-up. So we will noodle on that, and also I'll cross that bridge if we come to it. Okay, so Kathy asks, can the funds be used for hiring additional staff?
So it's a great question, and this is addressed both in the Federal Register Notice and in the FAQ. You can use this funding to support staff, to hire additional staff, but you must remember that this is time-limited funding. It's one-time funding. It has an 18-month period. So whatever hiring you're going to do should be considered temporary. But yes, you can hire temporary staff with this funding.
Okay, and then we actually got a message in the chat asking, can the gradual answer be repeated or provided in writing? And we will be, if my understanding is correct, expanding our FAQ document based on the questions that we received today. Is that correct, Stephanie?
Yes, ma'am.
So yes, you will get it in writing. Okay. Will the regional director confirm receipt of the submission email when they email in their letter of assurance and their spend plan? Will they get a confirmation?
Yes.
All right, there you go, Peggy. Let's see. And we have another question from Peggy. I believe you said we did not need to update ACL if our spend plan changes over time. Can you confirm or clarify?
I would, no, that's, if I say it that way, I apologize. What I had intended to say was that if your spend plan changes, that's fine. You will need to notify ACL about how your plans have changed. It does not require the same level of approval that a discretionary grant would in terms of scope, change in scope. There are a few things that would require prior approval, which is identified in the FAQ. But we do need and anticipate being informed about how you all are spending your funds and if you have to make changes to that.
All right.
But that will all come in also when we provide more information about reporting as you get your notice of award.
Thank you, Stephanie. From Jamie, we have a question. Can these funds be used for eligible activities back to the start of the pandemic?
And this is Alice. Would you like me to take that question?
I'm just wondering do we need a little more clarification of, are they asking about sort of retrospectively funding something they've already done, or this is Hillary, and I'm just a little confused about what this question is about.
I would say let's answer it in that way, and then Jamie, if that's not what you meant by sort of like paying for things that have already been like sort of refunding, I guess, for retrospective. If that's not what you meant, ask a different question.
This is Hillary. That's fair enough.
All right.
Hi, so this is Alice. So at this time, we anticipate the project period start date to be April 1st of 2021. There is some flexibility with providing pre-award cost, and that requires prior approval or approval from ACL. And that's for 90 days. One item to note when you're talking about that, and I think maybe Hillary was alluding to, is please remember that these funds are not to supplant other funds. And so that's something to keep into consideration when having any additional discussions as well. That is in the statute.
Thank you, Alice. From Blake, we have, should we include an SF424 and SF424A with the spend plan?
And this is Alice. I believe the SF424 refers to a requirement under discretionary grant, so I'd probably ask the program office to clarify that.
And I don't want to speak out of turn, so Stephanie, please correct me if I am wrong, but I believe it is just an SF425, which would be required 6 months in after the start of the project period. So you don't need to turn in an SF424. Those are different forms. So you don't need to turn those in the beginning. You'll need an SF425 for your first semi-annual fiscal report. I am going to hope that that was correct and keep moving. Let's see. So from Mary, we have, can these funds also be used for elders who have been found to be self-neglecting?
So again, as long as this funds are spent in response to, let me back it up. As long as it's related to APS and COVID, then it can be covered. So if the self-neglecting situation is tied to the COVID pandemic, or then that would be an appropriate use of the funds or an allowable use.
All righty, thank you, Stephanie. From Peggy, we have, in the FAQ document, the appendix talks about equipment purchases and getting a waiver prior to purchasing. Would that include, for example, a tablet to use for mobile documentation or video meetings with clients?
And so this is Alice to respond to that question. So in the fact document, we do outline if you, the state, the direct grantee, are purchasing equipment, which is defined as an item that is more than $5,000 per unit. So if your tablets were exceeding $5,000 per unit, not meaning that you purchased 10 tablets at $1,000 a piece, but per unit, per tablet, if they exceeded $5,000, you do have to receive prior approval from ACL prior to purchasing. I will note that this does not filter down below the state grantee. So if you have sub-recipients, you would be providing the prior approval, not ACL. So in short, you may or may not, and I would encourage you to reach out to your project officer and to our office if you're identifying equipment needs and if you have any questions on that and the process as well.
All right, thank you, Alice. I just wanted to remind everyone to please enter your questions in the Q&A box, not in the chat. We are trying to monitor both, but it is helpful to us if they come in through the Q&A box just to make sure we do not miss your question. But we have one about, is there a sample letter of assurances and initial spend plan that could be sent out? And I am referring back to some prepared question and answers. We do not have any templates. A letter of assurance should be on agency letterhead and include the list of required assurances outlined in the Federal Register notice. By signing the letter, the state is attesting or assuring ACL that it will implement the funds as outlined in the Federal Register notice. Your initial spend plan can be a narrative, a table, or both, and should indicate how the state is envisioning using these funds. Formatting requirements are identified in the Federal Register notice. So the answer is no, there are no templates or samples, but if you follow what is outlined in the Federal Register notice, that will be sufficient. Okay. From Michael, we have appears letter is high level. Assurance letter, our intent to secure and use the funds for the APS program. Spend plan, again, high level to outline our plans with the funds with expected amount in each area. That is correct, Michael. Yep. If I'm missing a question in there, let me know, but what you have said is correct. All right. From Sharon, we have our state APS programs that only provide investigations for adults 18 to 59 eligible to receive funding.
I'm sorry, I am also monitoring Q&A, and I have to say I did not hear the question. I'm sorry.
That's okay. The question is, are state APS programs that only provide investigations for adults 18 to 59 eligible to receive funding?
So this funding through the COVID relief bill references Section 2042B of the Elder Justice Act, which states that eligible entities are the agency or unit of state government providing or legally responsible for providing APS within the state. However, the funding formula is on the percentage of elders. And ACL and AOA, we have that established at 60. So if you are an agency that's 18 to 59 only, you would not, on the surface or at face value, be the entity that could apply for that funding. It would need to be the Elder Protective Services within your state, but we would encourage you all to partner and work collaboratively on implementing the funding. This is also on page 4 of the FAQ.
All right, hopefully that helps you, Sharon. Okay, from Leanne, we have, will this PowerPoint be made available to us?
Sure.
So yes,
there's nothing in this PowerPoint that is not already captured in the Federal Register notice or the FAQ, but we are totally happy to make it available.
And so will the recording of this conversation. Okay. From Shirley, we have the under 60 and over 60 APS are in 2 separate departments. It is my understanding that funding would go to the agency providing services to the 60 and over. That is correct, Shirley. From John, concerning the application, can the spending plan be included in letter of assurance, or should it be a separate document in the email sent by March 3rd?
It can be however your state wants to send it. I know that some states want to have it attached like an appendix or an attachment, and then the letter of assurance on top with the signature. So it's a package. Totally fine. Either way is fine.
From Sam, for temporary staff, would that include contract agencies who provide case aid services?
Alice, I'm going to turn that one to you.
As long as the case aid services were providing an allowable activity, so I don't maybe know your specific terminology here, but temporary staff could be hired with these funds.
All right. Can the funding be used for bonuses or hazard pay for APS staff?
So this is Alice again, and yes, the funds can be used for hazard pay or bonuses. You just need to ensure that you are following written, and I underline written, policies and procedures, and that those bonuses and hazard pay are allowable, allocable, and reasonable, and underlining reasonable as well.
All right. Julie asks, can you go over where fiscal and programmatic reports are to be submitted? So Julie, for the fiscal reports, your SF425, that is going to be submitted through the payment management system, and that link is included in the FAQ document and I believe the Federal Register notice. The programmatic reports that are due every year, or for the first year and then again at the end, will be submitted through Namers. It will be uploaded as a document in the administrative section within Namers. And that is also in the FAQ document. Paige asks, we are a county-run system. We plan to distribute some of the funds using a formula to the counties who conduct investigations and arrange for services. Should our spending plan describe our distribution formula for counties?
I think this is an Alice question.
So this is the spending plan that you're including in your letter. And I suppose I don't know what your requirements are on the program side for those spending plans.
So we, let us get back with you on that page. We'll put that in the FAQ for sure, updated FAQ. We'll look into how we handle it for, I know that for state units on aging, we do want to see their interstate funding formula. But let us follow up on that. This is all new, so some of these things, we didn't anticipate. It's a great question, and we'll get the answer.
Okay. From John, we have, could you confirm that activities under existing 3-year grants and this COVID grant are to be completely separate and distinct, and the use of the funds from one and the use of the funds from another grant does not relate to the use of funds from the other? So yes, John, this funding cannot supplant any other funding that you have, whether that is state funding or from another ACL grant. All right. And from Amber, we have, can this funding be used for clients that are served in other adult services programs? For example, adult services is the guardian for client, and we wish to use funds to keep them at a lower level of care.
So we would want to do a little follow-up on this, but I will say that the Elder Justice Act, in Section 2042B, is very explicit that the funds can only be used for adult protective services. So, with adult services, I don't know if that is your aging and adult home and community-based services, that's also a guardian, or is this APS that is a guardian? So if you wanted to follow up to that question, we can help figure the answer out for you on that one.
From Paige, we have, are there certain timeframes within the 18-month funding period by which funds need to be encumbered or targeted for use?
Hi, so this is Alice. So the project period or the time for which services should be provided is that 18 months. You do have additional time after the 18 months to liquidate those costs that were incurred during the project period, but that project period is 18 months in which the activity or your grant activity should occur. Now, sometimes you'll have orders that are placed that aren't received, but those should be few and far between.
Thank you, Alice. All right, and from another Alice, we have, in the FAQs, it mentions purchase of new or improvements to existing data systems and or technology infrastructure. It doesn't mention COVID. What would that look like to have an allowable, meaning COVID-related data system?
Mm-hmm. It's an excellent question, and it is addressed in the frequently asked questions, and I'll read from there. Purchase of equipment and associated technologies that will allow for secure remote work and enhance APS workers' ability to interview and investigate while they cannot physically visit during the COVID-19 crisis, as well as purchase of new or improvements to existing data systems and or technology infrastructure related to case management that enhances interoperability and communication of systems across locales, including across states. So if you're talking about a case management system, a data system technology system, you would need to describe how that will help your APS program share information or do its work better considering the challenges that you're facing now during COVID-19. Just because an investment is made now and has long-term benefit, that doesn't disqualify it from, being an allowable activity. It just you just need to connect it to COVID-19 now. And I think, well, no one cares about my personal opinion, but so yes, as long as you can demonstrate that your investment improves, enhances the work of APS during COVID, then it would fit under the purpose of this opportunity.
Thank you, Stephanie. And we have a follow-up from Blake. He says the SF424 is the budget form and the SF42A is the budget detail form. So Blake, you don't have to use those forms. You could submit your budget in a narrative or a table, but it does not have to be in the standard form. Okay. Paige asks if there's a CFDA number associated with this grant. Yes, it is on the Federal Register notice, and it is 93.747. From Kenyatta, we have, can the funding be used to hire an APS training coordinator? Our APS program covers vulnerable adults 18 and up. And so Kenyatta, yes, you can hire an APS training coordinator if they would be training people who also serve people who are 60 plus. And then you would just be reporting on that training. They could also train people who are also serving people who are younger than 60, as long as it is, that it's temporary and that the project period is 18 months and you're reporting on the percentage of older adults who are served in the programmatic period. Did I get that right, Stephanie?
Yes, and that the training is related to APS service within or the COVID-19 pandemic. So how do you do remote interviews? If you have to hire new staff, temporary staff, and you need to train them, things like that. But again, everything that you do needs to be tied to or in the context of COVID-19.
Okay, so we have, can these funds be used for vehicles that are in use by APS investigators?
I'm laughing because Alice said to us, you're going to get a question about cars. Alice, do you want to take this?
Sure. Yes, we did know that this question would come. A lot of states have carpools, and those are included maybe in your indirect costs. So those could be included. For a vehicle, you would need to follow the equipment prior approval process if the car costs more than $5,000.
So if it's cheaper than $5,000, that would be good. Okay, from Tanya, we have, what is the time frame funds must be obligated and expended? This is in the FAQs. The project period is 18 months, so grant activities must be completed within the project period time frame, which is to spend, incur, and expense against it, or obligate it by the projected end date, which is September 30th, 2022. Okay, let's see. Can any of these funds be used for administrative purposes, such as quality assurance for reporting back to ACL?
Paige, yes, thank you for resurfacing this question. We did discuss it, and yes, the Elder Justice Act does not prohibit the use of funds for administrative purposes or for indirect costs.
All right. I'm trying to look through to see if there are unique questions. Okay.
And then while you keep looking, Elizabeth, I'm just going to say, Paige, I will also follow up with you on your other question, and we'll add those to the FAQs for everybody who might be in a similar situation.
All right. Leanne, I see you've asked this a couple of times. Is it possible to use the funding to upgrade our APS documentation system? I think we kind of answered that earlier, but yes.
Yes.
Upgrading your documentation system would enhance your ability to provide protective services during the COVID-19 crisis. You absolutely can do that. Okay, John says, I am not clear on requirements for spending on clients younger than age 60. Housing services, for example, must be spent on those 60 plus.
So, yes. This was tricky. We spent a lot of time looking at this. The funding is for adult protective services that are serving, according to Section 2042B, that are serving older adults in the state. So if you have a direct client expenditure, such as securing housing, then that client needs to be 60 plus. If you are using the funding to train your APS workers on how do you support least restrictive housing for your whole APS program that's 18 and up, that is allowable. But a direct client cost needs to be for a client that is 60 and over.
So I want to suggest, this is Hillary. We did spend a lot of time talking about this, and we'll add an answer that is as clear as can possibly be.
Thanks, Hillary.
In the updated FAQ, and I'm speaking advisedly. As many of you know, I'm trained as a lawyer. We will make this as clear as can possibly be made in the FAQ. And if you have further questions about it after you see the updated FAQ, just be in touch with Stephanie, and we will debate all over again.
And I know we're right at time. I wanted to see if we could get one more, which is, if used for salaries and tracking how many cases are over 60, can the funding still cover 100% of salaries? We also have positions that were frozen by the legislature.
I'm not sure I totally get the question.
So I think I'm going to extrapolate here, Agnes, that she's asking, so if I am an investigator and this money is going to be used to pay my salary, is the percentage of my salary it can cover the same percentage that is of cases I'm investigating of people 60 plus?
We are not going to ask you to do time accounting in that way. If you are a program that serves adults that are both under and over the age of 60, and you're paying for staff time, that individual serves both, that's fine. Your reporting, though, will need to look at the percentage of people 60 and over that you served. But you don't need to do time tracking in that way. And you can follow up with us. I understand it's confusing, but you can certainly do a follow-up and we can talk about it more.
All right, we are at 5:32. We have a couple of extra questions in here. I am thinking that we will be able to look at the questions that are still remaining in the chat. And as we said, we will be expanding the FAQ document. So if your question was not answered live, or even if it was answered live, we will be expanding that FAQ document and hopefully addressing all of them. All right, so thank you so much for joining us today. For the people that we were able to answer your question, I hope that this was helpful. And if we did not get to your question, we will be expanding the FAQ document, and you can always reach out to us at ACL or to your regional administrator. We will get your questions answered as you're writing those letter of assurances and your spend plan. Thank you again so much for joining us, and we are so excited, thrilled, ecstatic, all of the words we said earlier to get this money out the door to you, as we know it is so, so, so needed. Thank you so much.